Okay, so the first technique we're going to go over is to help with some pubic symphysis decompression. You'll also help a little bit with the SI joints as well. But you'll see in the literature following this that it's mostly talks about that pubic symphysis and the anterior muscles, but the patients will say that they'll feel it over their glutes and that SI joint as well. So this is a good one to use on any of your patients that just have some general pelvic discomfort. You start with your patient lying down. Now, in your pregnant patient, you may have to raise the head up the bed a little bit, depending on how far along they are to make them comfortable. You just do what is best for them. For this one, you have them bend their knees up, and you're gonna sit down next to them. The first thing I always do when I do this with any of my patients or any techniques is make sure I go over with them that I'm not intending to hurt them in any way again. Stretchy discomfort's okay. And also that I'm gonna be touching them potentially in some different areas. Like for today, we're gonna be touching over potentially the glutes and making sure they're okay with those touches as well. So all I'm gonna do is just wrap my arm around her legs initially. And you can do this next series of techniques, you can break them apart or you can do them alternating, and it's up to you and your comfort. I wrap my arm around so that I'm using my skeleton, my humerus, to hold her leg so I don't get tired out if I'm doing multiple things through the day. But some physicians you'll see just hold their legs together, and I leave that up to you. So I bring my arm and wrap it around, and what I usually do is have them try and separate your legs apart for me. And you just hold resistance from them separating it. You do it for a count of 5. And relax. Now you can go through that and do that 2 more times for a total of 3 if you'd like to. I personally like to alternate them just to kind of help relax the pelvis overall. I also just give them a little bit of a rock in between, and that is just to kind of help relax them and all the muscles as well. From there, you're gonna come, and I start with 2 hands together between your knees, and I just want you to squeeze your knees together. And relax after 5 seconds. Now with both of these techniques, your patient only needs to push or pull about 5 to 10 pounds of pressure. So they're not trying to hurt your hands or beat you. If they are doing that, tell them to actually relax a little bit because you can make them uncomfortable. And then I just give them a little bit of a rock. And then repeat, pulling apart. 3, 4, 5, relax. And then the next one I do is you can do a fist, or if you started with a fist, which you can do if they don't have too much discomfort, do a single fist or go to a double fist at that point. Go ahead and squeeze together. 3, 4, 5, and relax. And then again, pull apart. 3, 4, 5. And the last one that we're going to do with that squeezing together is I bring my entire forearm between their legs. Again, I'm using my skeleton here to kind of help protect my own muscles. But if you want to do it, it's more comfortable for you to do it this way, that's fine. But the distance you're looking for is about the size of your forearm. And go ahead and squeeze together. And relax. Perfect. How do you teach this to your patients to do at home? So to do that, you can take a towel or a sheet. You're going to take that sheet, put it under their legs, have it between, and then they're going to twist it. So that's creating that same as you holding it together. They hold onto it with both of their own hands up here where it's twisted. Right here. There you go. And then try and separate your own legs against that. And so if they can do it, if they can go further, then you try and have them twist it a little bit tighter to try and hold their legs, okay? And then from there, and you do that again 3 times for about 5 seconds each at home, resting in between. From there, I'll have them take that same sheet, wad it up in a ball. Another child's bouncy ball also works perfectly for this if you have that at home. And then just squeeze. And this way you're not doing a gradiated, but it still gives the same thing where it's working those muscles over that pubic symphysis. Relax. To hopefully allow, once you've engaged those muscles and then they go into relaxation phase, the idea is that hopefully they'll start to realign back up to be more even versus being potentially slightly out from that point.